Good afternoon, everybody. Thank you so much for joining today's webinar, Securing Patient Payments in Epic, Reducing PCI Scope, Protecting Every Payment, and Scaling with Confidence. My name is Danielle Duclos. I'm the SVP of Marketing for Bluefin. Just want to give a couple of quick housekeeping items. Today's webinar should be between 40 and 45 minutes. Like any other Zoom, you can go ahead and type questions in the chat, and we will get to that at the end. Additionally, we are recording the webinar. It will be available on our website either later today or tomorrow, and you will receive a copy of this, and if you would like, a copy of the deck. Without further ado, I'm going to go ahead and hand it over to our first speaker of the day, Justin Stanley. Justin, take it away.
Thanks, Danielle. And thank you all for joining us today. As Danielle said, my name is Justin Stanley. I'm the SVP of Product here at Bluefin, and I'm joined by Peyton Erickson, who leads our healthcare practice, and Mr. Sean Gately, who works with enterprise organizations implementing payment security strategies across Epic environments. Today, we're going to talk about something that's becoming increasingly important for healthcare organizations, and that is how payment security fits into the broader healthcare technology ecosystem. Over the last decade or so, healthcare has done an incredible job modernizing the payment experience. Organizations have invested heavily in Epic, expanded patient engagement through MyChart, and introduced self-service technologies. All of those initiatives have delivered tremendous value. Patients have more flexibility, providers have more efficient workflows, and revenue teams have more tools available to support collections and overall engagement. But as payment experiences have expanded, so has the complexity of securing them. What we'd like to do today is take a step back and look at where payment risk is actually entering the healthcare environment, why many organizations are finding that traditional approaches aren't scaling as effectively as they once did, and what leading health systems are doing differently. So today I'll start by discussing the challenge, and then I'll toss it over to Peyton, who will then walk through what modern payment security looks like across Epic environments, including MyChart, Wisdom, Welcome Kiosk, and Willow Ambulatory. And lastly, Sean will share a real-world example of how a large healthcare organization approached this journey and the outcomes that they achieved. So before we talk specifically about payments, it's important to understand the broader environment healthcare organizations are operating in today. So as a whole, healthcare continues to be one of the most targeted industries in the world. And when you look at the type of information healthcare organizations manage, it's pretty easy to understand why. Healthcare systems sit at the intersection of some of the most valuable data that attackers can obtain. These systems manage protected health information, PII, financial data, often all within the same ecosystem. And for cyber criminals, that's an incredibly attractive target. At the same time, healthcare organizations are becoming more connected than ever before. Hospitals, physician practices, patient portals, third-party applications, payment systems, and cloud-based services are all exchanging information constantly. That connectivity improves the patient experience, but it enables more efficient operations, but it also creates additional complexity from a security perspective. And unlike many industries, healthcare organizations don't have the luxury of simply shutting down when something goes wrong. Patient care has to continue. Clinical workflows have to remain available. Revenue operations still need to function. And attackers understand this very well. That's one of the reasons we're continuing to see ransomware, credential theft, third-party compromise, and data theft remain as such significant challenges across the healthcare industry. What's important to recognize is that attackers are often looking for the path of least resistance. They're opportunistic. They're looking for environments where valuable information exists and where complexity can create gaps in visibility, governance, and protection. And that's where payment security starts becoming part of the conversation, because payment data is often one of the most widely distributed forms of sensitive information moving throughout a healthcare organization. One of the biggest shifts we've seen over the last several years is the evolution of the patient journey itself. So historically, healthcare payments were relatively straightforward. A patient arrived for care, received treatment, and then they completed a payment as part of the checkout process. Now, when you look at today, that experience is dramatically different. Patients are interacting with healthcare organizations long before they arrive for an appointment and often long after they've left. They might schedule care online, review balances through MyChart, complete registration through a welcome kiosk, enroll in payment plans, or make follow-up appointments months after the appointment. So what's really changed is that healthcare has become far more connected than ever before. Organizations bringing together clinical, operational, financial, and payment engagement workflows into a more unified experience. And we're seeing medical and dental records combined through platforms like Wisdom. We're also seeing greater collaboration across specialties. And we're seeing more patient interactions occurring through digital channels than ever before. And from a patient perspective, that's exactly what should be happening. Patients expect convenience, they expect access, they expect healthcare organizations to operate as a connected system rather than a collection of disconnected departments. But from a security perspective, that evolution creates new challenges. Payments are no longer isolated events tied to a single visit. They're part of an ongoing financial relationship that can span multiple visits, multiple departments, and multiple channels. As healthcare becomes more integrated, payment security has to evolve alongside it. And this brings us to what I believe is the most important concept that we're going to discuss today. When organizations begin evaluating payment security, it's natural to focus on Epic because Epic sits at the center of so many patient and operational workflows. But in reality, Epic is rarely where payment risk actually originates. Epic provides highly secure workflows and serves as the foundation for many of the experiences that patients and staff rely on every day. The challenge is that payment data often begins its journey before Epic ultimately processes or records the transaction. So let's think about what happens during a typical payment transaction. Before Epic ultimately records, reconciles, or manages that transaction, payment information has already been processed through various systems and workflows. In many cases, the data has already begun moving through the environment before Epic ever becomes the system of record. And once unprotected payment data enters an environment, every device, application, network, and workflow that it touches can potentially increase compliance obligations, operational complexity, and security exposure. What's interesting is as healthcare organizations become more connected, the importance of protecting payment information early becomes even greater. So when patient interactions span clinical, financial, and administrative workflows, organizations need a security strategy that follows the data from the moment it's captured, not just once it reaches the final destination. And that's why many organizations are shifting their focus upstream and asking a different question entirely. How do we protect payment information before it becomes a problem? And that shift drastically changes everything. As healthcare organizations grow, payment security often becomes less about technology and more about operational consistency. Think about how most health systems evolve over time. Maybe online payments are introduced to improve convenience. Then a few years later, an organization acquires new additional clinics or expands into new markets. New payment workflows are added, new departments begin accepting payments, and additional devices are deployed across the enterprise. Now, every one of those decisions is made for a good reason. They're designed to improve the overall patient experience, support growth, and create operational efficiencies. The challenge is that that complexity tends to accumulate gradually over time. And over time, compliance teams are trying to understand PCI scope across a growing environment. Revenue leaders are working to maintain consistent processes across locations, and IT teams are supporting multiple payment technologies, while operational teams are managing devices spread across hospitals, clinics, satellite facilities, etc. Eventually, leadership finds itself asking a simple question: how do we create consistency across all of this? Because that challenge usually isn't across one single payment channel, it's governing all of them together in a way that's scalable, secure, and operationally efficient. And that brings us to one of the most important shifts that we're seeing in healthcare payment security today. Historically, security strategies have been focused on defending the sensitive information. Organizations invest in stronger networks, better monitoring, more segmentation, and additional layers of protection designed to keep attackers out. Now, those investments are, remain critical. We're not going to discourage those, but increasingly, healthcare organizations are recognizing that there may be another way to think about the problem. Instead of focusing exclusively on defending sensitive data, they're focusing on reducing its value. Or to put it another way, they're devaluing the data itself. So think about what happens if payment information is encrypted at the moment it's captured, or if that information is replaced with a meaningless token or it ever gets reused across systems, departments, or payment channels. The conversation started to change. Now you're no longer relying solely on protecting the environment, you're protecting the data itself. The question really shifts from how do we stop every possible attack to how do we ensure sensitive payment information remains protected wherever it goes? That's the mindset we're seeing more healthcare organizations adopt today. They're protecting payment data earlier, reducing exposure through patient journey, and simplifying many of the compliance and operational challenges that come along with managing sensitive information. And with that, I'd like to hand things over to Peyton. Peyton works with healthcare organizations implementing these strategies every single day. And he's going to walk through what this looks like in practice across MyChart, Epic Wisdom, Welcome Kiosk, Willow Ambulatory, and the broader Epic ecosystem. Peyton?
Awesome. Thanks, Justin. So one thing that I consistently hear when speaking with healthcare organizations is that payment security is rarely the actual problem they're trying to solve. Usually they're trying to solve something much bigger. A revenue cycle leader may be looking for ways to improve collections while maintaining a positive patient experience. A compliance team may be looking for ways to reduce PCI scope and simplify audits. And then our IT leaders might be trying to create consistency across dozens of facilities, applications, and workflows. However, the common thread is that healthcare organizations are becoming increasingly complex, and they're looking for ways to simplify that complexity. What's interesting is the organizations making the most progress aren't approaching payment security as a standalone initiative anymore. They're viewing it as part of a broader effort to create consistency across the patient journey. When we look at successful organizations, 4 priorities tend to emerge repeatedly. They want to protect payment information as early as possible. They want to reduce the PCI scope and compliance burden. They want to create a consistent experience regardless of where payments occur. And they want a model that scales as the organization grows. The good news is that those objectives reinforce one another. When payment data is protected earlier in the process, organizations often find the operations become simpler, governance improves, and compliance becomes easier to manage. That's really the foundation of modern payment security inside Epic environments. To understand why this matters, let's look at how patients interactions have evolved inside of Epic. Most healthcare organizations no longer think about patient care as a collection of disconnected encounters. They're working toward a more unified experience where clinical care, patient engagement, scheduling, billing, and financial interactions all work together. Epic plays a central role in making that possible. Patients may interact through MyChart before they ever arrive for care. Registration teams may use Welcome Kiosk workflows to streamline intake. Billing teams may manage patient financial interactions through Wisdom. Pharmacy teams may work inside Willow Ambulatory. Staff may collect payments directly within Hyperspace during registration or scheduling activities. What's particularly interesting about Wisdom is that it highlights how healthcare itself is changing. Historically, dental care and medical care often operated in separate systems for separate records, separate workflows, and separate operational models. Wisdom helps bring those experiences together, allowing organizations to create a more unified view of the patient. That means payment interactions are no longer tied exclusively to traditional healthcare workflows. They're occurring across a broader set of patient experiences, many of which are becoming increasingly interconnected. From a payment security perspective, that's important because every patient interaction becomes another opportunity for sensitive payment information to enter the organization. The challenge isn't securing individual channels, it's creating a consistent security framework that spans all of them. One of the questions we get most often is, what actually happens when a patient presents a payment card? It's a simple question, but the answer explains why PCI-validated point-to-point encryption has become so important. Traditionally, payment information enters the environment first, and organizations focus on protecting it afterwards. The challenge with that model is that cardholder data can potentially pass through workstations, applications, networks, and systems before protection measures are fully applied. That's where scope begins to expand. P2PE changes the sequence. Instead of allowing payment data to enter the environment in clear text, the information is encrypted immediately inside the payment device itself. Whether a patient is paying at registration, in a clinic, at a welcome kiosk, or another point of interaction, the card data is protected before it ever reaches the workstation, network, or Epic workflow. From that point forward, encrypted data moves through the transaction process. For healthcare organizations, the value goes beyond encryption itself. By protecting payment information at the point of capture, organizations dramatically reduce the amount of usable payment data moving throughout the environment. That can significantly reduce PCI scope while also simplifying security responsibilities. And perhaps most importantly, patients and staff generally don't experience any disruption. The workflows remain familiar, the security simply occurs earlier. Let's look at how that philosophy extends across some of Epic's most important patient-facing workflows. For many healthcare organizations, MyChart has become the primary patient financial engagement platform. Patients expect to review balances, make payments, manage payment plans, and access financial information whenever it's convenient for them. Healthcare organizations want those experiences to remain simple, intuitive, and secure. The same applies to welcome kiosks. Patients increasingly expect self-service options that allow them to check in, update information, and make payments quickly without waiting in line or interacting with multiple systems. Then we have Wisdom, which represents something larger than a traditional billing workflow. Many healthcare organizations are adopting Wisdom because they're recognizing the value of integrating oral health into the broader patient care ecosystem. Medical and dental teams can collaborate more effectively, patient records become more unified, and organizations gain a more complete picture of the patient journey. As those workflows become more connected, payment interactions naturally become part of that ecosystem as well. What organizations tell us they want is consistency. They don't want one security model for MyChart, another for Welcome Kiosk, and another for Wisdom. They want a single approach that extends across all of those experiences. That's ultimately what modern payment security is about, not creating separate solutions for every workflow, but creating one framework that supports the entire patient journey. Once payment information is protected at intake, another question naturally follows. How do we support future interactions without repeatedly handling sensitive payment data? Healthcare is unique because financial relationships often extend well beyond a single encounter. A patient may make an initial payment today, enroll in a payment plan the next month, return for additional services 6 months later, or keep a payment method on file for future visits. Organizations need a way to support those experiences without continually storing and managing sensitive payment information. That's exactly where tokenization comes in. At a high level, tokenization replaces sensitive payment information with a secure token that can safely be used throughout the payment lifecycle. I often describe it as replacing something valuable with something useful. The token retains the functionality organizations need while dramatically reducing exposure to the underlying payment information. That allows healthcare organizations to support recurring payments, payment plans, cards on file programs, future encounters, and omni-channel payment experiences without relying on widespread storage of sensitive payment data. When you combine P2PE and tokenization, the conversation begins to shift. Instead of focusing on individual transactions, organizations can start thinking about the entire patient financial journey. A patient may interact with the organizations through MyChart, register through a welcome kiosk, receive a statement through Wisdom, enroll in a payment plan, and return for future service months later. Historically, many organizations secure those interactions independently. Today, leading healthcare systems are looking for a security framework that follows the patient throughout the entire life cycle. P2P protects payment information at the point of capture. Tokenization supports future interactions. Epic remains the operational foundation connecting those experiences together. The result is a more consistent approach to security, compliance, and patient engagement. And for many organizations, that's where the real value emerges. Of course, technology is only part of the equation. As organizations grow, operational governance becomes increasingly important. A large health system may have hundreds of payment devices spread across hospitals, clinics, physician practices, dental facilities, ambulatory centers, and specialty locations. Maintaining visibility across that environment can quickly become challenging. Organizations want to know where devices are located, who has responsibility for them, whether they've been replaced, and how they're being managed throughout the organization. Those questions aren't really about payment acceptance, they're about governance. What many organizations discover is that centralized visibility becomes just as valuable as the underlying security technology itself. It simplifies audits, improves accountability, and creates greater consistency across locations. For large health systems, that operational consistency is often every bit as important as the security improvements. Whenever I meet with healthcare leaders, I'd like to finish with a simple question: what actually changes? Because organizations aren't investing in security technology simply to check a compliance box. They're investing in outcomes. What we consistently see is stronger protection of payment information, reduced PCI scope, improved governance, simplified audits, and greater operational consistency across the enterprise. Perhaps most importantly, organizations achieve those outcomes without fundamentally changing how Epic works. Patients continue using MyChart, registration teams continue using welcome kiosks, billing teams continue working in Wisdom, clinical and operational teams continue relying on the Epic workflows they've already adopted. The difference is that payment information is protected earlier, managed more consistently, and exposed less frequently throughout the patient journey. And that's really the goal, not adding complexity, but reducing it. Now we've talked about the strategy and the technology. The next question is what implementation actually looks like and what outcomes organizations can expect. Sean works directly with healthcare organizations implementing these strategies every day, and he's going to walk through a real-world example of how one large Epic health system approached this journey and how the results they've achieved. Sean, over to you, my friend.
Hey, thanks so much, Peyton. I appreciate it. One of the questions we hear all the time is, this all makes sense in theory, but what does it actually look like inside of a real healthcare organization? I'd like to share an example that reflects a situation we see fairly often. This organization was a large multi-state healthcare network with hospitals, physicians, practices, outpatient facilities, specialty clinics, and a growing digital engagement strategy built around Epic. Like many health systems, they'd spent years improving the patient experience. They had expanded online payment capabilities, invested in MyChart, modernized billing workflows, and continue adding new ways for patients to interact with the organization. From a patient's perspective, things were working well. Patients had more options, payments were more convenient. The organization was delivering types of experience people increasingly expect from modern healthcare providers. The challenge wasn't that the payment experience was broken. The challenge was that the organization had grown significantly over time, and payment operations have evolved alongside that growth. Different facilities were operating somewhat differently. Different teams were managing different workflows. New Epic capabilities were being adopted. Additional payment channels were being introduced. Individually, none of those things were problematic, but collectively, leadership started asking important questions. How do we maintain consistency across all of this? There where the conversation really began. One thing I always like to point out is that projects like this really start with technology. They start with visibility. Before organizations can improve their security, governance, or compliance, they first need to understand how payments actually move through the organization. And that's often more complicated than people expect. When we work with health systems, we typically start by mapping the patient financial journey. Where are payments being accepted? Which Epic workflows are being involved? Which teams are interacting with payment information? How does payment data move from intake through settlement and future use cases? Once organizations have the visibility, opportunities begin to emerge. In this particular case, leadership identified three priorities. One, they wanted to reduce PCI scope. They wanted to create more consistency across locations, and they wanted better visibility in how payment operations were being managed throughout the organization. From there, the implementation became much more straightforward. Rather than forcing users into entirely new workflows, the focus was on strengthening security behind the scenes while preserving Epic experiences staff and patients already relied on. That's one of the biggest misconceptions we encounter. Many organizations assume these projects require major operational disruption. In reality, the most successful implementations are often the ones users barely notice. Patients continue using MyChart, excuse me, staff continues working in Epic, registrations continue following familiar workflows. The difference is that payment security becomes more consistent and more manageable across the enterprise. When implementation was completed, the first thing people noticed was necessarily the technology. It was the consistency. We often see in large healthcare organizations is that different facilities gradually develop slightly different ways of doing things. Nobody's necessarily doing anything wrong, but over time, these differences can create challenges from a governance and operational perspective. That's exactly what happened here. Before the project, payment devices were managed differently across locations. Documentation processes varied. Security procedures varied. Operational oversight varied. After implementation, the organization had a much more standardized framework. Teams were working from the same playbook. Processes became easier to follow. Expectations became clearer. And because there was a greater consistency, leadership gained better visibility into what was happening across the environment. That's really where many organizations begin to see value, not because they're adding something new, because they're reducing complexity that has accumulated over time. Security was certainly an important outcome. Reducing exposure to sensitive payment information was one of the organization's primary goal. But interestingly, security wasn't always the benefit people talked about most afterwards. What many teams appreciated was the operational impact. Compliance teams found audits easier to prepare for because processes were more consistent and documentation was easier to manage. Operational teams gained greater visibility into payment devices and workflows across all locations. Revenue cycle leaders appreciated having a more unified approach to managing payment interactions. And executive leadership gained confidence that the organization had a scalable framework that could support future growth. That's an important point because healthcare organizations are continuing to evolve. They're expanding digital engagement. They're introducing new Epic workflows. They're integrating additional patient experience. In some cases, they're bringing medical and dental care together through platforms like Wisdom to create a more connected view of the patient. As those environments become more integrated, consistency becomes increasingly valuable. The organizations that tend to be most successful are the ones that establish a framework capable of supporting the growth over time. As we wrap up, I'd like to leave you with 5 observations we've seen consistently across healthcare organizations. First, payment security has become much more than a compliance discussion. Increasingly, healthcare leaders are evaluating payment security as part of a broader cybersecurity and risk management strategy. Second, patient payment interactions are occurring throughout the care journey, whether it's MyChart, Welcome Kiosk, Wisdom, Willow Ambulatory, or traditional registration workflows. Payment experiences now span multiple departments and touch points. Third, protecting payment information at intake changes the conversation. The earlier organizations secure payment data, the easier it is often to become to manage compliance, governance, operational risk downstream. Fourth, tokenization plays a critical role in supporting modern patient financial experience. It allows organizations to enable payment plans, recurring payments, card on file programs, and future encounters while reducing exposure to sensitive payment data. And finally, organizations don't need to choose between security and usability. The most successful implementation strengthens security while preserving the Epic workflow patients and staff already know and trust. That's really the common thread we've seen throughout today's discussion. With that, we'd like to thank everyone for spending time with us today. One of the themes you probably heard throughout the webinar is payment security doesn't have to be about adding complexity. In many cases, it's about reducing complexity.
Hello. Sean, you were able to come on. Thank you so much for all of that. Very good
No problem.
information. Yes. So we are going to open it up to questions, and as those come through, I have my own question. We're talking a lot about complexity in healthcare. And obviously the Epic integration with Bluefin is one of our integrations. We have more in the healthcare realm. So, Sean, I'm going to pitch that over to you from that kind of commercial standpoint. Tell us a little bit about operating outside of the Epic environment, because I know with this specific use case, there's been discussions on how are we going to orchestrate payments in the future, or how are we going to tokenize PHI and PII data? Because we did talk today about the payment side of the house. What's your take on the sensitive data side of the house?
Thanks, Danielle. Well, I think we all understand, and for those of you who are joined us on this call today, that the healthcare industry is one of the most targeted industries from a data breach perspective, ransomware. People love to steal PHI data. And because of HIPAA regulations, the amount of built-in fines, the brand damage, the reputational damage that comes along with it. So as you're going through the process, if you have various practices might have Epic, some others might not. There are still tons of practices out there that have paper files sitting in file cabinets behind the desk. It is very important in this day and age that you are digitizing and tokenizing not only the payment information, but name, date of birth, address, social security numbers, all of that type of information. And more importantly, when you think about tokenizing data, a lot of your organizations have to share that data with third parties, right?
Mm.
And that is where a lot of data breaches come from. Because you as an organization might have the greatest cybersecurity and you might have PCI validated point-to-point encryption. But when you start sharing that data outside of your organization to a third party, it could be a collection agency, it could be additional practices that may not be within your own hospital network. That's where the real risk factor happens. So by using an intelligent tokenized solution that not only tokenizes that PHI data, but also that payment data, you're going to secure your organization not only for now, but for the future.
Excellent. And we're going to back up because somebody actually has a really good observation in the Q&A. And we talk about this all the time, but for those who are just joining and may not be up on encryption and tokenization and these fancy terms that we kind of talk about, let's take a step back and just briefly explain what is the difference between end-to-end encryption or E to EE and PCI validated point-to-point encryption. So I know we're all experts on the call, but who wants to take that one?
Sean eagerly raised his virtual hand.
I really thought I thought Justin would raise his virtual hands, but
Sean, you
But I'll
want to take
take it
it?
if you, yeah, I'll go ahead, Peyton.
Okay. And it really is such a great question. But Danielle already called it out, the difference between E2E and P2PE. But first, let's just get the nomenclature correct and what it exactly stands for. So
mhm.
E2E, end-to-end encryption, versus P2PE, point-to-point encryption. And from a very high level, what the difference is that validated P2PE is the gold standard for taking a card present payment. So where the point of interaction, you'll also hear it as the POI, is coming through a terminal. That could be a card present terminal where we're tapping, swiping, inserting Google Pay, Apple Pay on that device, or it even could be in a back office scenario where we have a device like this for keying in a credit card. The PCI has put standards in place for those organizations that want to take the next level of making sure that their patient's cardholder data is being devalued to the best of their abilities. Bluefin has done those certifications to be considered one of those validated P2PE solutions. But it really boils down to three key things that are the differences. The first is that the point of interaction, we're encrypting as soon as the card is tapped, swiped, keyed on a terminal. End-to-end solutions might very well be doing the same thing, but they haven't gone through the certifications and the rigorous testing and controls that Bluefin has done to become an actual validated P2P provider. And I'll share this resource here after the call, and I think it'll actually come from Danielle, but there is on the PCI website, you can view all of the P2P providers that are a certified vendor. The second thing is that the encrypted data that's coming out of the point of interaction is only being decrypted in a hardware secure module. And that is also called an HSM. Bluefin ultimately has two in the States. One is in Tulsa and one is in Atlanta. But ultimately, what that means at a high level is that there is no clear text cardholder data running through your ecosystem at any time. And the third and the final thing about validated P2P is that we give a chain of custody tool that we call P2PE manager to the merchants to control the chain of custody of the devices themselves. Our key injection facilities ship out devices in tamper label bags, which you as the merchant physically have to go into the P2PE manager tool to match the serial numbers with the tamper label to validate that this device has not been messed with in transit and it's ready to take production payments. Now, ultimately, when you're adopting a P2P solution, what it means for you from a financial perspective and from a time perspective is that now you're reducing your self-assessment questionnaire from an SAQD to an SAQ P2PE. And if that doesn't fall within your realm, to put it in perspective, an SAQD is around 330 questions, where an SAQ P2P falls around 33 questions, with 11 of those being around, are you writing credit card data down on a piece of paper? And we know that we're not doing that. So really, it's almost down to 22 questions. So a 90% scope reduction. Sean, would you add anything there, or Danielle, would you add anything?
I would just say it's not only the chain of custody. We're going to get PCI nerdy. There is a part of the PCI requirements, which is known as PCI 9.9. So if you're an organization that is handling POI devices, pin pads, shred key back office devices, in order to be PCI compliant, you must have an accurate inventory of where those devices are and who's in possession of them. Whether you have an end-to-end encryption, you have no encryption, or you have validated P2PE encryption. So the tools and capabilities that Bluefin has that it brings to the table are multiple implementations of thousands of terminals into this ecosystem. There's a ton of value that comes along with that because of the experience of what Bluefin has. When everything's all said and done, we will ensure that you have implemented an entire validated point-to-point encryption solution at the end of the day. Because the other difference between P2PE and end-to-end encryption, if you're a large enough organization, you would have to receive what's known as a NESA, which is non-encryption solution assessment. Now, those can cost anywhere from $150 to $250,000 in order to get that. And then your acquiring bank will then decide how much scope reduction they would give you. Whereas if you have a PCI validated solution in place, when that auditor comes in, you show them the paperwork, you say, I work with Bluefin, they check the box and you're good to go.
Absolutely. And the other thing I'm going to add, because let's nerd out just a little while more, is for those of you who may not be too familiar with Bluefin, we were the first validated solution for P2PE back in North America in 2014. At that time, there was only 3 worldwide. We have been doing this for a very long time. I think today we have over 120 devices that have been certified across the products. And then 27 KIFs, I'm not even sure, and about 200 partners that support the P2PE solution. But I have a question from one of our favorite schools, University of California. And these folks I want to say, have been using our Epic product solution. And his question is a good question because right now, through our Epic certification integration, we do carry the PAX devices, and I believe it's the A series. So his question, and I'm not sure if Justin or Peyton, you guys, or even Sean, from that kiosk perspective, are we thinking of as we expand, because we talked today about wisdom, we talked today about MyChart, we talked today about welcome kiosk, ambulatory. Are we going to plan on maybe expanding the devices as well, especially for those that may be enabled for kiosk? And Peyton, I saw you come off mute. Is this a conversation that we are starting?
Yeah, and at first I had to call out Sean, called out 2015. Thanks, Sean, for the official date that you've been with us. Thank you. No, I think so Justin might be able to elaborate further, but it's really processor specific. So EMV and NFC certifications, which really is the bottleneck and the limiter for us. Each device that we ultimately certify to takes between 12 to 18 months per processor. And our processors that we typically are going to work with are our main five: TSYS, WorldPay, Fiserv, Chase Payment Tech, Elevon. If you're one of those five, your go-to is most likely going to be a PAX terminal. However, we do have our EMV and NFC certification to Fiserv. So if you are a Fiserv merchant, you open the door up to another device line and another device OEM, being Ingenico Tetra. We have a couple of customers that are live with Ingenico Tetra, but what I will say is that the majority of our clients using Epic are on PAX and PAX A series terminals.
Justin, I saw you come on online. It's actually, I guess we could say Sean's name over at UCSF. Just wondering about, and it's funny because I was just having a conversation with PAX about devices last week in terms of, kiosk enablement, if we are thinking of anything additional. I'd have to go back and see and look at their devices. I'm not really sure what they have out there.
Yeah, I mean it's a I think Peyton did a wonderful job of framing that up, right? It comes down to these EMV certs, and that's kind of we're really kind of hamstrung, if you will, with EMV Co. and having to make sure that everything is lined up properly. But I will say that that is something we kind of take a look at on a pretty regular basis. PAX has been able to innovate pretty well and release some got some pretty cool new devices that are coming out, and that's likely a scenario that we'll look into in terms of additional kiosk requirements. And Sean, what I'd say is if you've got a list of requirements that you'd like to see, we'd love to have that intel or pain points that you currently have. If you could get that over to your account rep or CSM, that would be great intel to have on the product side.
Awesome. And because we touched on P2PE, just so everybody's kind of on the same level playing field, because I think the difference between E to EE and P2PE is it can't be understated. So let's talk really quickly about, if we didn't get too much in the technicality, but for anybody who's interested, the differences in the tokenization schemes that we have out there today, being vaulted in versus vaultless, right? And we don't have to spend too much time on it, but I think that as we progress across those digital channels and we're looking for what we call, folks, token interoperability, I always get that word messed up. What are we seeing kind of as the difference between maybe latency, storage, vaultless versus vaulted? And Justin, I know tokenization is near and dear to your heart. So if you have any thoughts on that.
Yeah, I guess we got to first set the stage with what's vaulted versus vaultless. What is that even, right? So with secure token generation, right, for devaluing data, you have two main models that are employed. You have cryptographic and non-cryptographic tokens. So simply put, a vaulted tokenization solution is typically a non-cryptographic solution. So what happens is somewhere your token provider has the ability to get back to that original data set. So if you send in a credit card number or a social security number, that token provider is going to return you back that placeholder, that meaningless value, that surrogate value that you're going to store within your environment. But under the hood, inside their platform, they have access to your data, right? And that's by design. They've kind of put the target on their back, right, to maintain that data for you and to keep it secure. But they do have their data, right? So that's a vaulted solution. A vaultless solution which is what Bluefin employs. Essentially runs a cryptographic process to generate a token based on the original input data. But even Bluefin does not have the original data or a way to get back to it, right? So it's almost like a split knowledge dual control by design. You keep the token, and when you supply the token to Bluefin, we can run a transaction or ultimately use that with our keys that are stored within our HSMs and whatnot to get back to the original data. So you've got, that's a little bit about the two different flavors, I think, in the industry in terms of how you generate the token. Under the hood, they're both going to provide the same value to the end merchant or to the end customer. At the end of the day, whether it's vaulted or vaultless is not really, I don't think you're going to notice a big difference there. It does a lot of things for us operationally. I mean, one of the design goals we had was that we don't have access to clients' data. We don't even have it, right? It's even if there's no big database at Bluefin that can get breached, and encryption keys that can get scoured and reverse engineered or whatnot, and ultimately leak customer data. So that's one of the kind of the feathers in our cap, I think, on a vaultless solution. I don't know if that answers
No,
where you're
it
trying to get
does.
to.
And the reason why I was asking that is because I think there was one really important slide in this presentation. When you start talking about more of a holistic security approach, your two kind of flavors of security become encryption and tokenization, right? And the way that we typically look at it is that P2PE is that point of sale device, or POI, I should say, because it doesn't have to be, point of sale. It can be back office, like we said. But then when you start looking at the PHI and the PII, we know we're not running that through a terminal, right? So that is where, iframes, tokenization immediately happening of that type of data becomes equally as important. So I almost look at those two as counterparts kind of existing together.
Yeah, encryption serves its purpose, right? We Bluefin, obviously, we're a tokenization and data security and encryption company, right? We see the value in encryption, but it's not the one size fits all, right? You look at a merchant that has PII or PHI in their database. I would encourage that entity to, at minimum, perform encryption, right? But when you start looking at encryption, there's a whole host of other things you have to talk about. Well, who has access to the keys? How do you rotate those encryption keys, right? What happens if the bad guy gets in and he can get the data and the keys are stored right next to it, right? You've done yourself no favors, right? So, you can put your money under the mattress, or you can put your money in the bank, right? So encrypting on-prem, that would kind of be putting your money in underneath your mattress and getting the data out, employing tokenization and putting it in the bank, in the vault, if you will, that safety deposit box. That's tokenization, right? So you're gonna with tokenization, you're offloading all the compliance burden, all the security operational burden in terms of key management, key rotation, and all those things. You don't have to mess with those, right? So it's not saying that they're both secure data security techniques that can be employed. One comes with a different set of challenges than the other.
Right. And so we're going to actually go toward wrap up. I think we have done our questions. And what I want to just talk about very quickly, and I think Peyton and Sean, you two are probably the ones to kind of talk about this very, very quickly, is when we look at the healthcare environment, this is just a microcosm in a way, the Epic portion of it. I know that we have both in higher ed and in healthcare proper, because higher ed also has hospitals and clinics and everything. It's become a little bit of a sprawl, if you will, because you can have everything from pharmacies to gift shops to paying for an x-ray in the emergency room. I would imagine that when you're talking to a healthcare organization, especially some of the larger ones that we deal with, that, Peyton, I think you kind of mentioned this, right? You almost have to map out their environment. So tell me a little bit about the consultative approach that you guys end up having to take with a healthcare organization to kind of just dig in?
Yeah, I mean, when we start talking about the healthcare system, I mean, it almost turns out that it's a small little city with
Hmm.
ultimately different owners for each of the departments. So, sure, we spend most of our time today talking about Epic and patient
Right.
payments. But when you get into the nitty gritty, we also start unraveling and peeling back the onion of we also need to have this same level of security and approach and strategy at our gift shops. Same thing in
Mm.
in our cafeterias or our outpatient facilities. We just need to, the biggest thing is just aligning all groups, all different domain owners within the organization as to what the strategy is. How do we devalue the sensitive information to the best of our ability? And then also, how do we create consistency across the board as well? I think it's crazy. I read a report, and this goes back to patient payments, but I had to read off this stat because it blew my mind earlier today. Is that having a consistent provider in place is imperative because once that patient, that client may be in a gift shop or whoever it may be leaves the facility or is discharged, and let's just say we had a terminal down and we couldn't accept payments, so we had to bill via paper invoice. It reduces the chances of that outstanding payment being made by over 50%. And if that bill is over $1,000, it reduces it by another 10%. And I don't know if some of the personnel that are still on the call here have felt that, but having a consistent vendor in place that sure is leading with security, but boasts the most amount of uptime is imperative because when that person leaves your facility, stats say that you might have trouble collecting on that payment. So
Mm.
consistency is key to our strategy and our conversations, and keeping everything with the same vendor is also very helpful too.
So adding to the complexity of what Peyton says and the approach that is taken, the first meeting is, okay, where are you taking payments today? Because we always find it's like you open up the closet and you find that sock that fell out of the laundry basket and you've been looking for it for a long time. There are always surprises that we come across. How are you batching payments on a daily basis? How is the revenue cycle management team working throughout the multiple practices and making sure that everything is coming together? Do you have call centers? Do you have remote workers that are working and need the ability to be able to accept securely credit card information over the phone or Modo transactions? Do you have an IVR requirement that you go through so you have a telephone tree because that can also be incorporated into the Epic environment or in your exact payment environment? The other big concern that we come across when we interact with practices that want to deploy is, hey, I don't have the proper cabling in place. So I need some time. So can I have a standalone device until I have the Ethernet network in place? Or do I want to utilize a Wi-Fi device in order to make that happen? So we go through a vetting process once we're engaged to really truly understand where you're at as an organization. More importantly, our implementation and integrations team, who has a vast amount of experience with this, we work with your project team and your operations people to make sure, okay, we're not going to turn on 300 devices from what we call standalone to semi-integrated in a single day. We'll schedule time with your team. We do it in waves and phases. We do pilots. We do tests. So we try to mitigate all of the challenges that do come across as you go through that process. But all of those scenarios we've come across, and then also understanding, hey, I want my chart. So now you're going to have that unified solution where you've got your MyChart, you've got Epic, and your revenue cycle people are going to thank you for being able to have this fully integrated solution under one umbrella. And it really is helpful from an efficiency perspective, from a collections perspective, and from a patient experience perspective. One of the things we talked about and was on one of the slides, millennials. My daughter is
Mm.
26 and my son is 20. they don't even want to look at you when they come in. They want to pay everything online. They
Hmm.
would love to be able to curbside pick up health services if they could, although we can't do that. So it's not only trying to account for, Nana who's coming in, or an old guy like me, that has all of his own personal physical problems, to now you've got the millennials and the Gen Zs, and those are things that we try to think about from a go forward basis, because ultimately those are going to be that's your market of the future.
Yeah. And I think that's goes a little bit to that tokenization we talked about too, because as things become more digital, how are you protecting all this information that's coming online? Which is the subject of another webinar, folks, and we will be having that in about a month when we do our mid-year cybersecurity wrap up. I think we're just about out of time, and so I want to thank you all for joining us today. I think this was a really great discussion. Thank you for your questions. Thank you, Peyton, Sean, and Justin, for sharing your knowledge with us. Do expect an email from me in the next 24 hours, Danielle, and I will be providing you a link to the webinar on demand and a copy of the deck. And thank you all so much for joining us today. Have a great day.
Thank you, everybody.
Thank you,
Thank you.
everybody.
Bye.